So the last Wednesday in July in 2009, I was taking the bar. I had gone out to celebrate with friends and woke up the next morning in a stranger's apartment. Ultimately, I figured out, with help from friends, we thought I had been drugged and I was taken to the hospital to have a rape kit done. And the nurse came in, she was really, really nice. Both she and a tech, and the doctor was interspersed, and went to start the evidence collection kit. But it was either the first or second one she had ever done, which was surprising and also sort of, it makes you feel very unimportant. Like what had happened to me wasn't a big deal, so it doesn't require someone who really knows what they're doing.
I don't care if that caregiver is the nicest person you've ever met on the face of the earth. Get them out of the room. Every patient has the right to speak with a healthcare professional alone.
So for someone who has experienced a sexual assault who comes to the hospital, those first responders have a really crucial role in how that person's process of healing and of justice, if they go through the criminal justice process, might continue. It really sets the tone. So if that nurse treats the person with respect, showing that she or he believes the victim, it really can make the difference between that person then opening up to law enforcement, continuing to work with the lawyers, continuing to work with the judge. Whereas if they feel judgment or disbelief, it is very likely that that could be the end of the person's process, because they, on top of the violation of the rape, they then felt like they were re-victimized by people who didn't believe them or were judging them.
Over the top? Over the side? And then you'd have a label on the cup. The seal should actually partially cover the label as well. So that if someone tries to pick the label up and take it off, what's it going to do? Rip the seal. Okay.
All of those nurses have received the sexual assault nurse examiner training, and then in addition to the training, there are some additional components to become certified. So there's a clinical piece, and then there is also a piece where they learn about the law enforcement and criminal justice process that will follow the exam to understand how that evidence might be used. So they sit in on a trial and hear an expert witness. They also visit a rape crisis center to learn about the advocacy piece and how they work with survivors.
In order to effectively use an alternative light source, you need some cool orange goggles, okay?
When a patient is being cared for and evidence is being collected, the room is sealed during that time because it is an evidence collection site. And so to be able to have a space where the patient can comfortably go in, take a shower after the exam is done, not have to walk out and interact with other patients, is a really great addition to the way that we care for patients.
So we're going to have a table and chairs to sit so the person doesn't always have to be laying on the cart.
Well, the thing that's really important about it is some hospitals have more training for the nurses than others. So right now, unfortunately, the level of care you're going to get is going to differ between hospitals. I think most nurses, if you talk to them, they all have a moment where they felt so out of control. I know I did, where I didn't know what I was doing, and that's one of the things that led me into doing it, is that I never wanted to feel that way again. I'll think about that person for the rest of my career. In the kit, the first one that's most important is collecting consent, obviously. The most important thing about doing these kits is, you want to restore the patient's sense of dignity and their own bodily autonomy. So they have the right to refuse or consent to any portion of the kit. The nurses are actually the ones, they do the speculum exams, they do the entire general exams, and they collect everything from head to toe.
As a result of having an advocate, receiving counseling from RVA, in the summer of 2011, I decided to sort of, pay it forward. It had meant a lot having her in that room with me, so I decided to become an advocate myself. I think one of the big things that, especially as I became an advocate and I realized oh, you can have nurses that have specific training to deal with all that comes with an individual who's been assaulted, and seeing how much knowledge they have versus someone else who is trying to do their very best, but just is not as well trained in these techniques. It makes a huge difference. And there's definitely sort of that thought in my mind of like, what if the nurse had been SANE trained? Would it have been any different? I don't know, but I would like everyone else to have or get a SANE nurse, because it's one less thing to worry about on a day when everything is horrible.